All right. It's been a while since I've seen y'all. I'm glad to be able to talk to you and be able to kind of present my next set of results. So that's great. What I do want to point out is two people that just walked in. Can you stand up? These are the people that make the PNA happen. Okay. The, Christina is and Danielle, they're the ones that actually send out the packages. They're the ones that scan all the data. They're the ones that get the great joy of going through and looking at the pictures that the kids draw. They are teenagers, for heaven's sakes, and it shows. Um, but the they make it good and make it so that this can happen. And I'm here to get to show you cool stuff. So today, I want to give you. I know that many of you have heard this before, some of this before, but there are new people, or I'm going to assume there are that haven't completely got the P&A down pat and know about kind of the overview. And this isn't. There we go. Okay. But to start with, the full name of the PNA, and I'm going to say PNA a lot, but it's the Prevention Needs Assessment. And this is a survey that is given to all 6th, 8th, 10th, and 12th grade students in the state. At least that's our goal, is to give it to all those. Because those are key grade levels in the progression of maturing, that we want to understand how they're approaching substance use. And so this represents a snapshot every year we give it of what it is looking like in those grade levels. Okay? It measures substance use, but it also measures an important set of aspects that actually I'm not going to present results about today, but they are there, about attitudes, beliefs, and perceptions that have been shown to be related to the decisions that students make about whether they're going to use substances or not. And so these attitudes, beliefs, and perceptions are called risk and protective factors. Okay? And the vast majority of the survey actually are these attitude questions. I thought I removed that point. Sorry. It used to alternate with the YRBS, but since the YRBS is no longer being given, the YRBS stands for the Youth Risk Behavior Survey. Since it's for the foreseeable future, the PNA will not be alternating with the YRBS. And so one important point is this was another student survey that was given that represented an important snapshot of not only substance use, but other risky behaviors like sexual behavior, like nutrition and exercise, and things like wearing helmets and other preventive things that could be addressed. That's no longer there. So now the PNA is the survey that is in Wyoming to measure some of this. Not all of it, but some of it. The 2016 has a nice long history to it. It's the 8th time we've given it. And this year we had over 80% of the school districts that participated. But that does represent a decrease from past years. Okay. So when we get all the numbers and Christina and Danielle scan it all and put it all in, we end up crunching the numbers and coming up with some PNA reports. And these are the how we report out these results. We have this state level report, which contains overall all the state level information. It also has county comparisons. So in other words, wherever possible, you can tell where in the measure after measure after measure after measure. Because I don't know where hey, we're the fifth highest in the county. And so that's the kind of level of detail that I tried to provide. We also provide county level appendix. Reason it's an appendix to the state level report is because you don't. And I'll be showing up here in the state for the state level. Then we have fact sheets because I know that you don't want to take an 80-page report to your city council. You don't want to do that. They're not going to touch it. But if you bring a two-page fact sheet, they're gonna look at it, and you get to explain it, and then you get to go in and say, we have more information if you want it. But those fact sheets are a door opening. So we developed some overall fact sheets, and some fact sheets that are on specific topics from the P&A that we thought were relevant to bring together. Each of those are 2 pages. And then we have the deep dive into data for those poor fools like me who really like to get into all the nuances. And this is where it provides all the frequency results where you can break it down by gender, by grade level, by race and ethnicity, and start to get into the data really deep. But generally, this is what I do. This is what we prepare each year that the P&A is given. So let's start talking about what we saw this year, in 2016. Okay, we saw this kind of participation for the district. We saw response rates that were typical of what we've seen in the past. So that's great. The 67% very 67, 68% in those districts that participate is pretty typical. Okay. I do want to say this doesn't represent the 9 school districts that didn't participate. So those were excluded from these response rates. As far as what it looks like as far as demographics, they look pretty typical. We have males and females about evenly divided. The ages are pretty much as expected, since we're going to focus on every other grade level, kind of these spikes at 12, 14, 16, and 18. Okay, 18 is partially because lower in general because of, if you remember back to this, we only get 53% of the 12th graders. 12th graders are really hard. Senioritis hits hard. I have my daughter is graduating tomorrow, and I can testify she doesn't attend school. She's getting all A's, but she doesn't attend school. So that's the kind of thing that happens in 12th grade. So sorry if I'm making you sick. All right. So, oh wait, there was one thing. So the one thing that I did notice that was kind of an anomaly was that Hispanic and Latino was a little higher than I had expected. Generally, that's been around 10%, and this time it's around 15%. So if we look at substance use, then this is going to be what I primarily focus on as far as results from the state level. There is, as I kind of mentioned, a lot more, but I thought we got to keep it to the core for this presentation. Oh, and Rodney, you need to signal me when I've got 5. Okay. Okay. So these graphs represent the top substance use in each grade level for lifetime and 30-day use. Okay. In lifetime, alcohol remains consistently the highest in all the grade levels. Okay. Then we've got a kind of a hodgepodge between a few things of e-cigarettes, which appear in every time in the top 3. And this is the first year we've asked about e-cigarettes. Okay, so you're not going to get trends on this. When we get to the trend graphs, you're not going to see that. But this is where the e-cigarettes appear. And then inhalants come in, which is pretty typical in sixth grade. They're the ones that tend to be at risk for that. It actually decreases in the older grade levels. Because if they've done it, they may not have brain cells left to do it later. But then there's cigarettes that come in and marijuana that pops in. I want to say that marijuana's popping in not because it's really changing, and we'll get to that, but because cigarettes are decreasing. Okay. For 30-day use, and this is what we think of is probably the lifetime when I look at it represents experimentation or more. Okay. 30-day use means these are the kids that have used recently. These are current users. And so in sixth grade, it's the typical low that we're seeing, only 2-3% using anything. They steadily increase with grade level, but alcohol remains the most used substance. This little cliff in 12th grade is an important one that I'm going to show you later in context of all the different substances. So, in the reports, there's a whole bunch of graphs that look like this, one for each grade level. Okay, and this is what I call my profile graphs. Okay, because what they do is I have lifetime use and 30-day use divided out. They're rank ordered from highest to lowest. Okay? And this is 10th grade. And we can see that in lifetime we're still having just over 55% of the youth saying they've used alcohol sometime in their life. But then there's that drop. It's a substantial drop to kind of a grouping of e-cigarettes, marijuana, and cigarettes. Kind of this grouping. We see a similar thing when it comes to 30-day use. Again, it's grouped together with highest to lowest. And just about 22-23% of 10th grade students said that they used alcohol in the past 30 days, sometime in the past 30 days. And again, but then there's a substantial drop. A grouping of cigarettes, marijuana, cigarettes, and chewing tobacco. And then another drop. So as I look at this data, I start to see these kind of things that I want to pay attention to. Is where there's these grouping of substances? Is there some commonalities? And obviously there are, especially when we're talking cigarettes, e-cigarettes, and chewing tobacco. Those are all tobacco products. The other thing we measure and divide out is the heavy drinking and then some problem behaviors. And so the binge drinking and when there's half a pack or more of cigarettes is something that can be substantially important because they represent the extreme of risk as far as use. If we look at the sixth grade in comparison to in high school, these grade, that's my profile graphs, yeah. That is true.
Is there a way to parse that out?
I haven't seen a question that parses that out. YRBS asked the first time, and it's the data we do have for e-cigarettes, but they just said basically vaping or e-cigarettes. I have not seen a question that parses out what kind of substance they use in the e-cigarettes. we quite potentially can. We're going to be, every time we give it, we revise the survey and look at what is the most current topics. And so certainly it's an important, at the same time I'm going to state that we're not seeing marijuana use changing, and that's going to very much from year to year. And that's kind of going to lead into what I'm saying here. Okay. So after I present the profile graphs, the next is that I want to present a trend. But I also want the trend to be in relation to the rest of the substances we ask about. And so these are what I call my trend graphs. And we do one per grade level. In fact, we're going to go through all 4 grade levels really quickly to see some patterns that are important that we've seen change over time. Okay. In 6th grade, as I mentioned, use is low. Pretty much across the board. Almost non-existent in the ones that are on this side of the graph. So that suggests that that's our baseline. That's where the kids start out as. And what I want to point out is that in the baseline, alcohol use has continued to progress lower, even at the lowest levels, when it's so small already. And so when I pointed out the 2 or 3% that alcohol was, well, we were higher just a few years ago. And that represents a significant decrease that we've seen in this grade level. All right. And so the other thing would be inhalants are decreasing. Inhalants I was concerned about a few years ago. And it has decreased as well at the state level. Okay. So if we look at 8th grade, this is what the trend graph overall looks like, but let's focus on the highest ones again. Okay. Alcohol, a few years ago, saw a substantial decrease. But we've maintained that in 8th grade for 30-day use as well. Marijuana has remained flat. This is despite our concerns with the legalization and the changes that have happened around marijuana, that we were kind of expecting this to go up. So far it hasn't. And that's at least good news counter to what we thought it was going to happen. Cigarettes, substantial decrease. And then inhalants also are seeing a decrease. And along with a little bit in chewing tobacco. If you look at 10th grade, 30-day use, what we see is, again, a decrease, primarily in the first 2 years presented here, but again, at least in the last 2 years, we've maintained that decrease in alcohol. Marijuana is flat. Cigarettes has seen a substantial decrease, and this pattern has been the reason that marijuana has popped in as second most prevalent. Not that marijuana's changed, but cigarettes we're continuing to see a decline. Now, that being said, remember, e-cigarettes are popping in. I don't present these as trends on the trend graphs, but the e-cigarettes are becoming one of the most common used substances. If you look at 12th grade, then we do see, again, a pattern. Alcohol's decreasing. Chewing tobacco's decreasing. Overall, and this is where we're going to get into an overall, we're even looking at the most high-risk behaviors, and this is demonstrating, we're going to see 8th and 10th grade. In binge drinking use, we're seeing decreases as well. Sometimes this is the hardest to actually impact because the hardcore people that drink still continue to drink. However, we're seeing decreases in binge drinking as well. and decreases in heavy cigarette users. Same pattern in 12th grade. And so I will say, this sets up going to college as being good because at least they delayed it compared to what they used to as they leave high school. And binge drinking, of course, is one of our greatest concerns of what could happen in college. At least they've delayed it. If they've delayed it, their chances of participating in the behavior even post high school is less. So this is my picture that I have right at the beginning of my reports, where I show kind of what I call an overview. And this is an overview of two types of change. Okay, so notice each line has two. We have a comparison of the previous year with the current year. Okay? The standard on that is that I've set a certain amount of percentage point change that needs to happen before I tag that as meaningful. Okay. There's also a comparison to the moving averages of the 3 previous times. So what does that mean? I'm going to go back. Okay, close your eyes if you couldn't say. Okay, so you notice those red lines on the graphs? Those red lines represent the average of these 3 years. The amount that they have changed in the past few years is kind of represents how much I'd expect them to change just kind of by chance alone. If that average amount of change is actually greater compared to that little red line average, then they're tagged as meaningful as far as the change. So when I'm talking the comparison of 2014 of the 2010 to 2014 average, so it's that little red line, and how much variation or how much each time it changed from year to year in those 3 years, compared to what I'm seeing of how much changed in 2016 to that red line. Yeah. Oh, 5 minutes. Okay, okay. So overall, what I'm seeing is that there's a lot of blue. Blue is good, orange is bad. Overall, the kids are doing much better. 30-day use, that was lifetime. This is 30-day use. And again, look at how much blue. Kids are getting better. So what I'm seeing is that was the patterns I'm seeing in substance use. But the P&A does not stop there. So here's other information that you have available from the P&A. You have those risk and protective factors. In a similar fashion as the profile graphs for substance use, I have profile graphs for risk and protective factors. I have trend graphs for risk and protective factors. I have those kind of tables, the blue and orange, for risk and protective factors. So we can see how attitudes are changing, and those have been shown to be related to substance use. We also, as I mentioned before, county comparisons. Going after grant funding, oftentimes one of the best arguments is you have a problem relative to some comparison. County comparisons provide that. Or you need to say that, look, we're doing a great job in my county to the county commissioners. Look, we are ranking the lowest. This gives you evidence of that. There's alcohol in the community. These are your questions about, did you attend a community event where large amounts of alcohol were available? My kegger question. Okay? It's, where did you get your alcohol the last time you used? That's important when you're looking at, am I going to target in my county the retail access or social access? And if it's social access, where am I going to go? Is it going to be with trying to look at parents and parent education? Or is it going to need to be more along the lines of friends who are 21 year older, so shoulder tap time type things? Okay. Okay, those are current for 2014 are currently available, and as soon as the state gets the reports, which Drew looks like she's frantically going through, and marking it up so that I can make lots of corrections, then we'll release them. I can't give a time frame because I'd have given my drafts to the state, so it's kind of in there. And then attendance at community events where alcohol is involved. Other information, social norms questions. These are my questions about how often do you think most students in your school have used alcohol or cigarettes? Okay, we have mental health measures which we added to try to quantify how many students are at risk for serious mental illness using a standardized and well-researched scale around this. And then also getting an idea of how many kids are thinking about or have attempted suicide in the past 12 months. And then finally, we got bullying, some more county comparisons, and detailed results, and then the detailed results in the appendix. P&A website is where all these are, for past years are available. And you can get to them, and as soon as we release, we'll be putting them there along with the Department of Health website. Any questions? Yes.
Can you talk a little bit about the religiosity question and define what that is? Because that comes up in my conversation.
Okay.
Positive more.
So it is a positive. It is one of the protective factors that is measured on the P&A. It is one question, as flawed as it is, and I will say that there are flaws to it, which simply ask on how often do you attend religious or other spiritual services. So it is a protective factor. It has been shown. It had what we call. So when we look at relationships, we look at how people answer that question compared to their actual use that they report. And there's a way of quantifying that so that, or putting that into numbers to say how strong of that relationship is. And the relationship is such that the higher, the more often that people say that they attend services, religious services, the more often the less likely they are to use, or at least report use. And to give a quantifiable, I believe last time I looked at it, the correlation amount was a negative 0.3. It's not super strong, but it is been shown to be related to it. And significant. Yeah.
Will we know what school districts didn't participate in the survey? Because that could have an impact on our county results.
Yeah, we report that in the results. We report that in the reports, and I can pull it up if we need to. If you want to talk afterwards. Yes.
So if I have one school district that participated and one school district that did not, will my county reflect a school district that did participate in that?
It would depend on the county. Converse did not report.
At all?
We did not report on Converse at all. The school district that did participate is getting a report, though.
Repeat that?
So I create reports for all the school districts and schools who request them, and those school districts that participate will be getting a report.
Will I be able to get that report from my school district?
Yes, you can get it from your school district. The school district, or I will not say yes. I will say that the school district has the potential, if they so desire, to release it. asking it, but if it's not asked for, they're not going to release it, probably. All right.
We're going to, we'll have more time for questions at the end. And Eric, I don't know if you want to get out of this somehow. I'll just let you do that. I think one thing you should know about Eric and I is that Eric's wife's name is Lara, and my wife's name is Lori. At WISAC, we have researchers named Laura, Laurel, and Laren. So it seemed only natural when someone named Lauren applied that we would hire her. And in fact, that was the conversation. Well, she fits. We didn't look at the resume or anything. Actually, the story is that Lauren came from the University of Florida, and we brought her out here for an interview just over a year ago. It was the last Friday in April, and it couldn't have been a more miserable day. Just like ice, spitting snow, and we were pretty much convinced that there was no way she was going to move here. And so she was sitting in my office with Eric, who we had this great moment where Eric said well, you should know, one of the things about Lauren is that one of her specialties is behavioral health disparities. And Eric says, so how would what do you think the behavioral health disparities in Wyoming are, given that we don't have, it was like the most complicated question ever, and her face was like, you want me to answer this now? We're still working on that answer. But she did come, and we said, is there anything we can do to convince you that Wyoming can actually be a lovely place, even though that's not how it is today? And her response was, I'm so tired of being hot and sweaty, I really want to move here. And so we hired her. She had the right name, and she wanted to not be hot and sweaty anymore. And she hasn't looked back. So if you haven't had a chance to work with Lauren, she's great. And she's going to talk about what we know about opioids and the such.
Thank you for that introduction. I still look forward to spring whenever it gets here. Someday, maybe even summer. So today I'm going to talk to you guys about opioids, what we know, the data that we have, the data that we're using, the data that we could potentially be using, because I know that's a question that's come up a lot as I've worked with the different communities. So here we go. So in case you didn't know, opioids are a big problem. Did everybody know that? Okay, good. We're on the right start here. So there are different types of opioids. When we talk about opioids, we can talk about prescription drugs like Oxycontin, we can talk about fentanyl, but it also is heroin. So when we talk about a lot of this data, they're kind of combined. And you can see, oh look, okay. So this line is any opioid, and you can see these are overdose deaths, and this comes from the CDC. And you can see we're on a huge rise here. And it's not only the prescribed opiates, but also the heroin. So we have to look at both of these when we're talking about opioids. So the data that we currently have, that we currently use, comes from the SEOW profiles. The SEOW is the State Epidemiological Outcomes Work Group. And Rodney and Eric and I are all part of that group, along with other state organizations and different people who are interested in having data to make data-driven decisions. So the data that we currently have and that we're currently using include the opioid-related overdoses, past 30-day use, and then also the prescription fills. And I'll get into each one of these. So the first one that we're going to look at relates to the overdoses. This isn't overdose deaths, but it's just overdoses in general. And this is looking at the hospital discharges, and we're looking at the ER rates and the inpatient rates per 100,000. So it's not a general count, but it's this rate over the population. And we get this data from the Wyoming Hospital Association. And this is a preview. Please don't take a picture. Please don't tweet it or anything. These haven't been released, so I'm just giving you a little preview. So this is what the SEOW profile will look like when it comes out. You can see here, this is a chart. Again, it's broken down by county, so we can see that. And there's also the state level right here, but you can't really see it. But there's a little description. This is the ER rate, and then this is the inpatient data. So you can see both of those and you can see the different rates by the different counties. And then also we'll have a graph here looking at the numbers so you can see those as well. So this is one of the pieces of data that we have for the opioid use. But again, when you're looking at this data, remember, it's not only prescription drugs, it's also the heroin. So keep that in mind as you move forward.
Lauren,
Actually, this is opioid.
Renee has a.
This is,
Well, we don't have a, in Summit, we don't have a hospital, so is Summit up there? I can't see this far back. Is anything reported?
no, Sutherland's down here at the bottom because it does not have a hospital.
So Summit, Niobrara, and Cook.
Yeah, Sublette, Niobrara don't have hospital data for that.
Can you say who's at the top and the bottom?
Yeah, we
or
can't
Wyoming?
find them.
Okay, at the very top we have Carbon County. And then it goes Sweetwater, Hot Springs, Natrona, Fremont, Washakie Park, and then there's the Wyoming data, Uinta, Sheridan, Lincoln, Johnson, Laramie, Goshen, Campbell, Bighorn, Teton, Albany, Platte, and Converse. So, oh, there's so much talking. Any questions? Yeah.
Yeah, with this, so how about like your smaller counties, like let's just say Bighorn, where there's only, 10,000, 15,000 people? Is that skewed a little bit because one patient could really affect that?
That's why we do it by the rates. That's why it's the population rate per, is it 10,000? 100,000.
100,000.
Yeah, so it kind of addresses those issues of the smaller counties. So we're looking at this larger rate instead of just, there were 3 in one county compared to the 6 in a larger county.
Okay, so the question, just as a repeat, because I know that the question was, is what happens in the small counties because there, one death or one hospital admission can count for a lot. And the answer is first of all, we standardize so that they are comparable by population. So that's why it's the rates per 100,000. The other thing is that it does, however, lead to potential instability from year to year. So they can increase. We do try to kind of get that variability, that change from year to year less where we can by combining years. We don't have enough years on this yet at the county level to be able to provide that, but we will eventually combine years and it will help in that concern.
Yeah.
So, what you're looking at is hospital admissions, or you're not asking what county they're coming from. Where I live, people go to other hospitals out of my county. They're going to Washakie, they're going to Park, pretty much. So, but you're not asking what county they're from when they're
No,
going.
this is just from the hospital association. This is their discharge information. These aren't
Okay.
surveys that we're asking the actual individuals.
Okay.
So if they do go to another county, they'll be
They're
in that other
the
county's data. For sure. Right. Is there another question? Okay. Okay, so very exciting stuff. I love it. I love the questions. I love the excitement. Okay. So moving forward, we're also, as Eric said, we have P&A data, and we did start asking about prescription drug use. We asked about their past 30-day use of a prescription medication to get high. And I just showed the 6th and 8th grade, but we also have the 10th and 12th grade data here as well. So again, you'll see this when the SEOW profiles come out. And again, it's ranked by the different counties, and up at the top we have Campbell, Fremont, Natrona, Albany, Goshen, and then there's Wyoming. And again, we have the percentages over here. And like Eric said, right now we don't have trend data for this, or do we? Or is this just 2016 data?
No,
Oh.
this is a case of combining 2010, 11, 2010, 12, and 14. Again, this is a case of the group that met to create these, that commissioned these profiles, the SEOW. They decided that at the county level, where possible, we combine years. And for the P&A, we'll combine 3 years of data. So this is a kind of a point estimate of that moving average that you saw in my reports. And when we get to updating with the 2016, it'll be 12, 14, 16.
Awesome, I did not know that. Always learning, right? Okay. The last opiate specific data point that we have in the SEOW profiles this year is also the prescription 2 fills by county. So Schedule 2, for everyone who doesn't know, the DEA has different schedules of different drugs. All opioids fall within this Schedule 2, so this is the data that we can look at. And this comes from the PDMP, which is the Prescription Drug Monitoring Program, which all pharmacies are reporting into. So whenever they fill a prescription, they have to sort of play into or put that information into a system. And so that's where we get this data from. Just because there are a lot of fills doesn't necessarily mean that there's a lot of prescription drug abuse, but it means that there's a lot of availability of that. So you can see here, Uinta's at the top. And then we have Hot Springs, Fremont Park, and again, it goes down like it did in previous graphs. Yes?
So just to address kind of the similar question as the hospital data, this is by the patient reported zip code of where they live. So this is actually of the patients as far as their, and so it isn't of the where the prescription is filled as far as the pharmacy.
Okay, say that again, Eric, say that again.
So it's by the people. It's not by the pharmacy. So
Okay,
it's where
so
they
it's
live.
just where they live. So in Goshen County, they may not necessarily be getting the prescriptions in Goshen
But
County.
their
They may be
address
going.
is-
But it's their address. It's the patient's
Right.
address.
Well, it's
There's-
the patient's.
Oh.
We don't do it to address, we do it to zip code.
Okay, so the patient is reporting, I'm reporting that I live in Goshen County and I have these prescriptions, however, I could have filled these prescriptions in Laramie County.
Yes.
Okay.
And there?
Is it only if they're filled in a Wyoming pharmacy?
Yes.
Yes, because the PDMP is a statewide system. I'm sorry?
Schedule 2, can you, if a Schedule 2 prescription, if you're filled in, well, I guess you can fill it wherever. I was just wondering if there was classification where you had to fill that Schedule 2. Because some people have pain contracts and it's under a Schedule 2.
Mm-hmm.
Anyway, to follow them through those pain contracts, I was just kind of curious.
Well,
Don't have that answer.
okay, so the PDMP was specifically created to track that potential concern as
Yeah.
far as whether a person will go to multiple pharmacies and to get prescriptions to try to hide their behavior. And the PDMP was specifically designed so that it would catch that.
And every pharmacy is following the PDMP? Because I didn't think that was a requirement.
It is not a requirement. The vast majority of them are reporting.
Do we have a list of who is reporting? Is there a way to access that?
I do not have that list. It exists, but I don't have it. You could ask the pharmacy board. It would be
Okay,
a
now I'm gonna
request to the
ask you one
pharmacy
more
board.
question. So for those of us that live especially in border towns, is there a way that you're aware of for us to access, like, I would say in my county, more people go to medical services in Nebraska than they do in my community. Are you aware of those, of the states that border us, if we can access that information from them?
Currently, no, so they're working pretty hard to get data sharing agreements
Okay,
to put into place, because they recognize that that is a concern.
thank you.
So on that first graph that you showed, it had like carbon was at the top with overdose. That one right there.
Yep.
And now carbon on this one is like towards the bottom. Does that mean that they're probably using more of the overdoses are heroin because there's not the availability to consume that, or is that?
Good call. Good question.
I don't know if I can answer that. I have not been in this data.
That is a potential, we don't have the data currently that can establish that.
Okay.
In counties where you have a real small hospital that is not gonna keep and admit a person who has an overdose, they're gonna be transferred to a bigger hospital. How does that show up on there? Because Niobrara didn't have any on that first graph, but I'm pretty sure there has been some, but they would have gotten transferred.
Good question.
Yeah, that's exactly right.
And a lot of times get transferred out of state.
Out of state, absolutely.
Yeah.
So,
Especially
if the keeper of all knowledge about hospital data were here, his name is Joe Grandpré.
Throw him
His
under
email
the
is
bus.
He can answer that better
Here's
than
his
I.
home address, his phone number. You can talk to him.
Send him a text.
So I think, I'll let Lauren go on with her
Please.
presentation in a second. I think what you're getting to is the same thing we've been getting to for 2 years. Opiate data is difficult. It's not as easy as understanding 30-day use by kids. If people are using prescription drugs, it doesn't mean they're abusing them. They could have cancer. You know, so we're struggling, and so what happens, like at the SEOW level, is that we are trying to put together the pieces to get an understanding of some kind of understanding of what's going on in Wyoming, and then you have to marry that already problem with data with the fact that we have a very rural frontier state where the data already is difficult to understand, that the sample sizes are small and everything else. So what you're doing is what we have been struggling with at the state level, and we wish we could answer all those things. We do have more data than we thought we had.
Yeah, and I'll get to that in just a second. So thank you.
But
So the last thing on the SEOW profiles that relates to opiates is the general drug data when it comes to consequences, when it comes to drug abuse violations. And we have this data available by adult and by youth. But again, be careful because all the drugs are sort of lumped in together. So we can't really tease out opiates at this point. But it's good to know sort of where your county is falling when it comes to these violations, when it comes to arrests. Okay. Can you change it before you guys ask any more questions? So some of the other data that we also have the National Survey on Drug Use and Health. This comes from SAMHSA, but unfortunately we can't break it down to a county level. This just comes in the national and state level, and you can look at metropolitan areas, but we don't really have any of those here, so can't use that as much. We also have CDC Wonder data, so these are the death certificates, so we can look and see how many overdose deaths we've had, but that comes with its own issues and concerns. We also have ARCOS data, which Eric has been working on. ARCOS, it comes from the DEA, and they're monitoring the manufacturing aspect of opiates. If I'm correct, if I'm incorrect at any point, just jump in. So they're tracking opioids from when they're manufactured all the way to the distribution, so we can see sort of where they're going. But it's not very specific. It's the first 3 digits of the zip code that we can determine it by. Yeah, so we have that data. It's a little wonky. We're still working through that. We also have the young adult survey that WISAC did last year in 2016, and we did ask questions about prescription opiates in that as well. But again, that was just one survey. Pretty sure we're planning on doing that again, so we'll have some trend data for that. So this is the stuff that I actually do, and I can actually answer your questions. So as part of the SEOW, we wanted to do a data gaps analysis. We wanted to find out all the data that we do have, what we're already collecting, what other states are collecting, and this is sort of the results of that. So what else do we have? We have the water system, and that's the Wyoming Ambulance Trip Reporting System. So this is used by EMS, and everybody has to report into it, and we can look at Narcan, just Narcan administrations. Does everyone know what Narcan is? Naloxone, the opiate overdose reversal drug, right? So if somebody's having an overdose, you can give them Narcan, hopefully they'll revive. So we can look at that, we can track that. We're working on a project with that right now, and I'll get to that in a minute. So that's one data source that we have. We also have the Wyoming Public Health Laboratory Chemical Testing Program. They recently joined the SEOW, and they're going to start, well, they already do test for different drugs, but they're going to start getting us data on opiate drugs and opiate results. So things when it comes to DUIs, probation and parole testing, drug courts, and court supervised treatment. So we'll soon start having that data, and we're working with that. We also have the PRAMS data, and I can't recall what PRAMS stands for. But basically it's a survey that's given to women who've recently given birth, and there is a question on there if they've used prescription drugs within the month of giving birth. So we have that data coming in. We're also working with DFS, the Department of Family Services, to see if they have any data that we could be using for opiate-related information. And that's sort of a new partnership that we're working with. We could look at poison control, so looking at calls that people have regarding overdoses. That's something that we could do. And also we do have these drug take-back events in these drop boxes that we could be using. Whether it's counting how many events we have, there's a lot of different ways that we could do that. So for water specifically, we're working on a report and a project with EMS, looking at the administrations that they've had in the last 18 months, what will be the last 18 months, seeing when they're giving Narcan, if it is effective, if people are coming back, those kinds of things. And we're also going to be conducting focus groups and interviews. And this is more related to a different project that we have, but I think there could be some useful data here because we are breaking things down by county. So how many administrations are in a county and things like that. As part of this analysis, we also were looking at what other states are doing. Obviously, we don't have to reinvent the wheel if we don't have to, so we wanted to see what other people were doing. A lot of states are doing these drug take-backs, but their effectiveness is still yet to be seen. I think they're really important when it comes to access, but how we track that, a lot of the research that I've seen, and when they do look at what drugs are being taken back, a lot of it's cold medicine or expired aspirin, so.
I didn't think they were supposed to look at it.
It depends on the state, and it depends on who you have. You need to have a pharmacist and I think a law enforcement officer, so you're not like, stealing the drugs. So that varies.
In
and
Wyoming, we don't look, by the way, so everyone knows.
Yeah.
They're not supposed to.
They're not
It's
supposed
part
to
of the-
look at all.
Yeah, they're not, it's DEA regulated very strictly.
Oh.
They're not supposed to see what's being collected.
Do they measure like
They weigh
pounds?
it.
Okay.
They put it directly into a black bag and weigh it for me.
Okay.
Some places don't weigh it, but we
Yeah,
weigh
so
it.
that's another thing. I've heard from different counties the different ways that they do that. Some people weigh it, some people have looked. I've talked to people who've had a pharmacist go through it, so it kind of varies.
I can send you the DEA regulations
Okay.
on those drop boxes if you want.
Perfect. That'd be great. Yeah. Okay. Other information that we could gather, that other states have gathered, is treatment information. So SAMHSA collects TEDS data, its treatment, episode, I don't know what the D is.
Data
But
set.
there's, what is it?
Data set.
Data set, there it is. So we could look at treatment information, but in Wyoming, I'm not sure how many treatment locations we have. I don't think we have many, so I'm not sure how useful that data would be for us. We also can look at hospital data for neonatal abstinence syndrome. So when babies are born addicted to opiates, we can look at that data as well. I've seen other states do that, especially Florida, because they have had a huge issue there, and I came from Florida. And other states are also looking at naloxone administration, looking at how often it's being given, whether or not the reversal is successful, things like that. Yeah, question?
So Lauren, we do have treatment data from the Department of Health that comes through their system, so it's state-funded treatment centers.
Right.
Which there's at least one in every county.
Oh.
But we don't have very many that do the medication-assisted treatment specific to opiates. And I think there's further grant funding coming down the way to support more of that. But we do have treatment data. that
Okay, so we do
by
have treatment
state.
data by state-funded organizations, and there's one in every county. I apologize. I did not know that. All right. So, as part of this data gaps analysis, we didn't want to just find out what we had or didn't have, but we also want to be able to give it back and make it useful for stakeholders. So that's what we're doing right now. The current plan is to sort of repackage all this different data that we do have and get it back to stakeholders in a way that makes it useful and ways that you can utilize it. So it's not just me standing here for 10 minutes, remember everything that I say. So that's our plan. We're working towards that as the SEOW little mini group. So get excited for that one day, maybe? Yeah. Okay. So I need everybody to stand up. Okay, it's been a long presentation, a lot of questions. Okay, I need everybody put their hands together. And then stretch out and say, opiate prevention. Okay, stay standing, stay standing. Now, to make data exciting, I need everybody to create an interpretive dance to summarize what I just told you. I'll give you 2 minutes to get ready. Okay. You can do it as a group. You can do it as an individual. Just kidding. That's all. But if you do want to do an interpretive dance, then you can record it.
I need to stretch my knee out anyway. It needs to go straight.
Okay.
Let's do that. So we wanted to leave some time for you guys to have the opportunity to ask us questions about data, whether it's about the PNA, whether it's about opiates, what we don't know, whether it's about some other data we might have. We just want to give you guys the opportunity to ask anything, and we'll either give you the answer, or try to find the answer, or something. So what questions do you have? No. Yeah.
What kind of success, if you've had any, of going through the coroners who are doing autopsy or drug tests on unknown deaths related to suicides, which is what they'll originally be looking at if it's an overdose?
So my understanding is that they will go back and, based on the tox screens and the autopsies, they will add notations that go on the death certificates, and those go to vital statistics and are included in the totals that we have for deaths. So it is that is some of the cleaning that happens. They've also, I believe they have started doing more trainings with the coroners to improve the reporting and the identification of that. I will say that's one of our challenges with data too, because if they improve it and change how they're doing it, that's going to potentially change the numbers that we come out. It might go up if they're better at identifying it and it actually exists more often than what they had maybe shuffled it off to a different category. And so those are kind of the challenges in dealing with what we call administrative data, the things like the hospital discharges or the death certificates, is that they can change on us, and it could the results that we see may not reflect changes in actual whatever underlying thing we're looking at, but maybe better reporting or better identification.
It may change the trend,
In other
but maybe
words,
about
it's
reporting.
dependent upon whether or not the institution wants to see a glass half full or half empty. What kind of a spin they want to put on it?
I would generally say it's more along the lines of how much training and things that they feel like they can invest. It's almost more resource related than than the messaging they want to put on it. Though I can't say that doesn't play a role.
Other questions? Yeah.
So a lot of us wonder about the doctor shopping, especially when we follow the PDMP. So I do also have some data that I can share with everyone that the doctor shopping has decreased because of the PDMP, even though not all pharmacies are taking part in that prescription drug monitoring program. So I can also share that, but if you guys want that information, that came from the Board of Pharmacy, I think,
Yeah, so
last month.
David Wills, who's the
Yeah.
PDMP analyst, is a member of the SUW. He presented recently, and doctor shopping is down.
Yeah.
And go ahead, Drew.
I just want to clarify that for the PDMP, every pharmacist is required to participate. It's doctors who have an
Okay.
option to participate.
That's it. I knew there was
Yeah.
something.
Okay.
Thank you.
So I do want to say, though, this is another case of administrative changes that can affect things substantially. And this is part of why we didn't include doctor shopping as one of the measures within of things that we have, is because the definition of doctor shopping has changed and is changing again. And so when a definition changes, then all of a sudden what's comparable to the past isn't comparable in the future. And so I will say that under the longest standing definition of doctor shopping, that we have seen substantial decreases, but they are becoming more, they are adjusting their definition in this next year so that they are becoming more sensitive, which means that probably the rates will go up again.
Okay.
And it is, David is presented, and doctor shopping is definitely down. And we have seen differences in Wyoming, but also nationally, in how the opiates are coming out and stuff. So for example, we know that the sales of OxyContin are down 40% in the last year. And that has a lot to do with doctors saying, whoa, wait, like maybe I don't need, there's so much in the media now that that's not. And so we also know that there's that, and you've all heard this, that there's this movement from an opiate addiction from a prescription to heroin, and then you have heroin, and then you get in a city where there's too much carfentanil in the heroin, and all of a sudden, I was in Buffalo, New York a week ago, and doing a presentation, and that weekend in one day they had 8 overdose deaths because of the heroin that just came into town that day. So we know that kind of stuff is happening, and so and we've all worked in prevention. You know, you like squeeze the balloon on one end, you think you're doing well, but on the other end it kind of gets big. So things like that are happening, and we see that in small microcosms in Wyoming. And doctor shopping is one of those places. So, and I think anecdotally we've had law enforcement saying they've seen more heroin and stuff, but we'll see. Trying to get all the data, and of course as data people, we're just looking at data and trying not to look at anecdotes and popular literature and stuff. Other questions you might have for Eric or Lauren or I, or about data in general or anything. That's it? You gotta have some questions.
Lauren, when will that occur?
The data gaps analysis? Or the data gap, like where we package it, repackaging it? We're just starting to meet now with the epidemiologists at the Department of Health about what that looks like. And we have all this data, and it's all in these different forms. We want to make something useful. We don't know what that product is yet, but hopefully by the end of September is our deliverable. Bill?
Is there any way that the 3 of you could present this data to the Joint Labor Health Committee at some point?
If someone asks us, we're happy to present.
Rodney, could you present this data?
Do you speak for the Joint Labor Health Committee, or?
I know a guy.
We are super happy to do it. We just have to be asked to come present to a committee. I actually said to someone the other day, maybe it was Tracy, I'm a little surprised I've been in Wyoming for 15 years doing this work and I've never been asked to present to a committee or to the legislature. We're always happy to do it.
That's interesting.
We have the trends, and I'm going to share something with you in a minute that's going to rock your world, but any other questions? Yes.
When the PNA does come out, will there be like a press release that, I know there's a lot of PMO people here that we can share in our communities, because that data is fabulous, and it's showing that we are really moving in the right direction. But our schools don't always do a great job of even sharing the PNA, and we know how to find it.
Or
But it would, or
They don't even know what
look
it
at
is.
Right, but it would be fabulous to be able to share it and then educate our stakeholders and our community. So will we be?
Yeah, I will work with the Department of Health to get a press release. It'll probably be a joint press release from the Department of Health and the University of Wyoming. And then, of course, from there we can share it out.
Matt?
Is there any conversation about bringing back the YRDS?
Nope.
Nope.
Next question.
So I will say, if your coalitions talk to, as the coalitions talk about the importance of it. It's important. I will say, it's a loss in my job and in yours. And we've lost it.
There was a conversation when it was lost that we could add some of the questions like the ones on sex to the PNA, and Eric's answer was nope. There isn't a conversation about that now. There initially was some conversation about could we combine the PNA and things like that, but at the same time, the conversation is always, can we make the PNA shorter? Not, can we make it twice as long? So we don't see it coming back anytime soon. Yes, Tracy?
Well, and I think, to me, that there's 90 districts now that do not do the PNA. That speaks volumes of, like, people seeing less the importance of the prevention needs assessment. So I think as CPSs or prevention people across the state, I think it's really important that that's a big focus over the next year because 9 districts, that's a lot. I mean, in the last,
But with the loss of awareness, there's more discussion now on some of those about, oh, we do need something, maybe the PNA
there are
does. So we may see
some come back.
some come back because of the loss of awareness.
But at the same time, I'm not going to, so I don't know, did everyone hear what Tracy said?
No.
Tracy, you gotta turn around.
Yeah.
So I think it speaks volumes. So there's 9 districts that did not do the PNA this time around, and 2 years ago, there was only 2 districts?
There were 4.
4 districts, so.
And then back in 2010, no, that's long prehistoric history, we had every district participate.
So I think that's a huge necessity in our state, and that should be something over the next year that we focus on educating our districts on why this information is so important. Because if we don't have that data and we don't have it for every county, we can't really see what the trends are across the state.
Okay, so I'm going to speak to one thing on that. When in previous years, a lot of the comparisons we used to like make funding decisions or to give to the state to make funding decisions and such, we're going to combine 10th and 12th grade. Okay, so that we had a high school estimate. However, because of low participation, I have to back off for any time we use 2016 data now to make those comparisons to just the 10th grade, because 12th grade actually had problems such that in particular counties I couldn't use 12th grade. So even though the response rate overall didn't change terribly much, I actually did have localized problems that resulted in more counties not having 12th grade estimates, where in the past I have.
Go ahead.
You should do this presentation with the State School Board Association and the State Board of Education.
Well, we're always happy to present to where people ask us to come.
So you guys just
And
need an invite.
we just need an invite. We can't force our presentation on people. So, and I know if you haven't, Eric always goes out when the PNAs come out to different coalitions and presents it and things. So just let us know. We love going around the world. And I will add to sort of the notion of the PNA. If in terms of doing really good prevention, and I know we're in a challenging era right now. In terms of doing good prevention, there are 2 fundamental pieces that you have to have in a community. The first is a good survey like the PNA to give you your data, especially on youth. And the second is a really strong coalition with the right sectors. And those 2 things have to be in place. And so you have to work on those things. So if you do get your good coalition going, but you don't do the PNA, you got to think about how do we get the school people on board, because otherwise it's really hard to make decisions and stuff. Other questions for us about data, what's out there, what's happening? Steve.
Is there any correlation between youth marijuana use and districts from Colorado?
No.
We haven't seen that yet.
I haven't run the numbers exactly, but there is no obvious tell your grandmother type thing.
It's one of the things. There's a lot of like stories going around. There's like maybe people use it, but they just go down to Colorado to use it, and then they come back up and stuff like that. But what we haven't seen is huge changes in the trends. And where's Monica? And we haven't seen that on the NCHA either, have we? At UW.
This year, in 2017, we did see. It's one data point. We did see about a 6% increase.
So if you guys don't know Monica, she does the AWARE program and other things at the University of Wyoming and works with the National College Health Assessment here. And that's one of the issues at UW is like what's going to happen with marijuana. So we hadn't seen but a little bit of an increase recently.
Right. So not much on the southern border or the northern border with Montana and Colorado, a significant difference.
Yeah, but I will say it's a good research question that could take we could take, as researchers, it would be a really interesting question to say, what has been the impact of legalization in different states on border towns? And we haven't been asked to sort of really, or paid to answer that question. There's a lot of other stuff going on. I know I was a member of the Governor's Marijuana Impact Assessment Council, and that was an interesting thing. That was something they looked at, but it's been a year and a half now. So I was a little behind it, and there are a lot of other things that came out of that. I'm happy to talk to you about that at some point if you want to. But it would be a really good research question. But honestly, I work with a lot of states all over the country, and I work in Oregon a lot as well, where marijuana is available retail. Doing some stuff with Washington right now, and for the most part, prevention across this country has ignored it. Partly because the Obama administration, their take on it was leave it alone, especially coming down through SAMHSA, that's our major funder, and partly because of the opiate crisis. It's fallen off. So as we get our federal, as stuff comes down from SAMHSA and the CDC and stuff, it's all about underage drinking, because that's still the biggest problem, and opiates. And that's what we're doing. That's what we do in Wyoming too. So we haven't been able to. It's a good research question. Yeah.
I find it interesting that marijuana is listed as a Schedule 1 drug, opiates as a Schedule 2. You were talking about the 9 school districts that did not participate. I have a hunch that I know one of them is in my county, it being the most urban school district in the county, the other school district being a very rural agrarian school district. So the statistics for Laramie County, my guess is, are pretty well skewed because of that. When I talk to law enforcement and I talk to people that are involved with our drug and DUI court, the statistics that are showing for Laramie County do not bear out as to what our law enforcement and drug and DUI court and our court system are seeing within Laramie County. And when you talk to the kids, it's available. And it is available big time. And it is being used. And it's being brought in by biker gangs. And the kids are going down to Colorado and they're bringing it back as edibles.
And
they see nothing wrong with it.
Right, and so you touched on a couple things. The first thing about marijuana that's interesting is that what we've seen over time with the legalization medicinally and recreationally is a decrease in the perceived risk and harm of marijuana, right? So kids are, how is it bad? It's a plant. It's good. It's like vegan, and so as that perceived risk goes down, abuse goes up. So that's part of it. And then I think that it's true too. Like as NCHA, we may start seeing that bump. I think there may have been a lag between Colorado and coming, so we may see it more. But we certainly, at a state level, have not seen an increase of marijuana use on the PNA yet. So it'll be interesting to see where it goes.
And you guys are going to continue to collect that data on marijuana, because next year in our deliverables for the PMO, we're not working to do marijuana education, prevention education. So you're going to continue to do data collection on marijuana. Okay.
So,
that's
so,
what things going away.
So on marijuana, we've actually improved it over kind of in foresight of hopefully keeping it. One, marijuana's always been a question on the PNA. Okay, and both for 30-day and lifetime use. Okay. Second, we've added at the state level 3 questions about marijuana to the behavioral risk factor surveillance system, the BRFSS, the purpose. So that is new, and the results for that are going to be coming out in the 2015 or 2016 purpose release. So that's that. And then, of course, we also know that because of the high-risk pool that young adults are, we've had marijuana questions on the young adult survey, which will be repeated as well. So it is a topic that we are continuing to monitor, even if it's not currently the focus.
Yeah. I'll be curious to see that data after a year or two.
Eric, can you also speak to why the school districts are not participating? What's their rationale or reasoning for that? And then maybe what are some of the resources you can offer to the communities to help them have those conversations?
Okay, so the primary reason is one that's really difficult to counter, and it's that they don't have time. They say that it is off their mission. They have to really focus on getting their test scores up, covering the academic material, and basically don't want to fit it in amongst all the many other assessments that they have to do either because of district or state level requirements. Okay, and so that is their primary argument for not doing it. Their secondary argument sometimes is truth telling, and we have and I will say that the P&A website has three purposes. Okay, one is it's to inform the schools and school districts about the survey. We provide the script that's used, the questionnaire that's used, the different sets of frequently asked questions and handouts that are there. I would encourage you, because of that first purpose, to go look at the informational materials that are on the P&A, because most of the time when I get a question, do kids tell the truth? I say, I've got a handout for that. It's on the P&A website. Okay. Second reason is to inform parents about the survey. They need to be informed of what their child is being asked to participate in, and so that's why we have the survey link to the survey right on the front page so they can see what they're being asked. Third, and for you guys most important, is the results. I will say that in districts that are actively working with the coalitions and seeing the value of the data, it usually goes smoother. I'm not saying you guys are on the ground, but from what I hear is when we get a quick agree from a school district, it's usually because they say, I know the value of this data. The biggest incentive we have to ask for the 45 minutes that it takes to administer the survey is the results. And so I guess to answer Felicia's questions, one, the resources I would advise you to do it. If there is something in resources that could help, that is missing, and you could help, let me know. We'll write it up, we'll put it on the website. We'll make it available to you, okay? The other thing would be the results. Bring them the report. Say you can get it for yourself, for your own district. Do you have to sign in? Hey, look, you can click here and it says email me your password, and they put in their email, and they'll come and they will get an automatic thing that says here's your password. And they can get in and see their own results. They can see their own interactive graphic for their district. They can see it, and if you walk them through it and show them how there's tie-ins, they'll see it. Show them how the publicly available part is really important. Don't tie it up in their own stuff, because your decision making oftentimes has to be on the public side, the county level side. And so, but they're not participating, makes it so we can't have the public side either.
Lynette had her hand up.
You know, I would just say, and this might be a critical time again for us to go back in, like you say, and educate our school districts, because I have a good relationship with my superintendent, and I will honestly say she was not at all impressed with YRBS. And the reason she wasn't is because it wasn't easy for us to access that county-specific data and school-specific data. In order to get that, she had to do that for us. And she did not see that as her job to meet with everybody in the community and access that information. So they like the P&A because we can access that data. So this might be a time to go back in and remind them the P&A and the YRBS, are not the same. Not the same user-friendly format. And so, sometimes I think they just don't understand how easy it is for us to access that data, and all they have to do is administer the surveys.
Hey, Christina had a comment because she's actually did a lot of the phone calls to the school districts. So,
one of the things about the YRBS was a lot of the counties that didn't know whether or not they wanted to participate thought that we were exactly like the YRBS. So I literally spent 30 minutes explaining how we're different, and that usually, as soon as they figured out why we were different, they agreed.
Okay, so there was one other thing that I want to mention because it happened this year and probably resulted in the greatest amount of non-participation this year. is we made phone calls, emails, letters, every kind of contact multiple times that we tried to do it. And the people that primarily that did not participate, there are a few exceptions, but primarily did not participate, simply just didn't call us back. Or didn't return the surveys when we sent them out. And that is really hard to counter, I will say. And that is part of why we try to communicate, and we'll try to do better, even better, but try to communicate with all of you at the community level to say, these are the communications we're having with the schools and school districts. Especially, and usually we did that after several times of not hearing anything because we couldn't get to them and they just wouldn't pick up. And so that is when the conversation, that's the hard part. And at that point, that's why we really do need grassroots.
We're almost out of time. Tara, you wanted to say something.
Have you guys reached out to the School Board Association and given a presentation like this so then they can go back and tell their school districts, guys, this is important. You have coalitions that would like you to do this too. But if it comes from them, from above, and us from below.
We have not been invited. I will say that.
I just emailed Brian Farmer and asked him to invite you.
Great, because I would love to do it. I will say that there is one thing that we are doing. So there is an education conference that's happening in Laramie in 2-3 weeks. And Sean's not here, but he's my kind of my go-to person for actually doing the survey work. So he's the one that does my databases now and stuff like that. And he and I are going to go present. We're also going to have a table for YSAC and the PNA up at this conference to reach out to educators. If we can present at the other places like the superintendent's conference, we would love to. But we are trying to reach out better to that. Yes.
And whenever we've had you in Carter County come present to our community and our school districts, we've had dramatic improvement in engaging people, working towards policy stuff, particularly with tobacco. That's always been real helpful. Eric, you're very popular.
Well, Eric is going to even be more popular now. Please, yeah.
I just have one more clarifying thing that goes back to Lauren's presentation about the hospital discharge data.
Yeah.
So I asked your Grand Prix whether it was by the county of residence or by the county in which they were seen, and it's the county of residence. So if a Bighorn County patient is seen in Park County, it's counted for Bighorn County.
Okay, good. Okay, we're going to take a break. I just want to give you this one small tidbit of data to send you off to the break. There's a couple things you should know about. One is, and if you've not ever seen it, you should see it. The picture Eric and I have created. We've presented it at the Society for Prevention Research and everything else of Wyoming from 91 to today or to 2015. We didn't have prevention through the 90s. And now we started prevention, really science-based prevention in 2001 with PNA, coalitions, everything you guys do. And what we saw is this like trend of 55% and it's just turned down. And now underage drinking's around, I'm talking about underage drinking's around 31%, right? So if you haven't seen that picture, it's a really great picture and it speaks to the power of prevention and what's happened in Wyoming. And so what I wanted you to know is that my son London, who you've been hearing about for 15 years, is now the media producer, let me tell you some more stories about him. No, London is the media producer for UW Student Media. It's a place called Dynamic Media. And he and I have been, as part of the block grant, creating a documentary film about what happened over the last 15 or so years in Wyoming and how it's changed. Some of you have been interviewed. We're making that film. It should be out by the end of the summer. We should be done with it. It's going to be great. It's got data in it. It's got people's interviews. It tells the story of prevention in Wyoming. I have proposed to show it at the National Prevention Network Conference in California in September, so we'll see. The other thing, this is the story I wanted to tell you. So you know prevention has changed things, right? So we start here. If you didn't know, YSAC economists did a study in 2012 looking at the cost of substance use. And we've talked about it for a long time. And while some people don't believe it, it's a really good study. And we looked at alcohol, we looked at tobacco, we looked at other drugs. And what we learned is that annually alcohol costs Wyoming society $843 million. Right? It's in premature, in 2010 dollars. It's premature death. It's treatment. It's it's work, it's crime, all those things. It's up to $843 million a year. So almost a year ago, Felicia said to me, so if we know that, could we know like what prevention is worth? In essence, what is the value of prevention? That's a really hard question. So for the last year, I've had an economist working to answer that question. And right now we have a report out. It's such an important idea that we're not just doing it at WISAC, and we're not just having the state look at it. We have an outside reviewer looking at it from the CAPT in Boston. It's coming with a fact sheet, so you can do it. And this is the answer. Alcohol costs $843 million. We know that prevention has decreased underage drinking by more than 40%. What we know from literature about delaying the onset is for every year someone doesn't have their first drink, you have less likelihood to have an alcohol use disorder when you grow up, right? So the answer is, we use 2014 PNA data for that. The answer is that in 2014, there were 389 12th graders in the state of Wyoming that will not have an alcohol use disorder that would have had an alcohol use disorder because of the work you do. And that's worth $122 million.
Wow. That's what?
That's for one class, and that happens every year. And every year that the numbers go down, and every year you guys push that first drink back, that $122 million gets bigger. So that's the thing I was going to tell you that blew your mind, and it's true, so we have to keep doing what we're doing. Yeah.
Where did you say we could find the pictures?
Of that?
No, the picture, you said the picture, it was the picture of 90.
Oh, yeah, we've shown that a lot of times. If you email me,
Okay.
we'll send it to you. We've done it in a number of places and shown it.
It will
Happy
be
to
in
show
this
it to you.
report too, because it's
I did, because this is who I am. So, yeah, Bob Barker. Thank you, Lauren. Paper. Are you guys ready? All right, so we didn't want you just to sit and just listen to us all day. But I wanted a couple things to start with. I'm going to do something interactive with you. We're going to start and we're going to get into groups and do some work. But I do want to say Eric, and I don't know if Eric is staying around for the rest of the day. He's back there somewhere, but you can always get a hold of Eric. I definitely will be here the rest of the day if you want to chat with me. Lauren, are you going to be here?
Yep.
Yep. And then Tracy asked us to be here. Hey, Tracy asked us to be here in the morning tomorrow in case anybody wanted to. Are you guys? I don't even know what's on the agenda. Are you guys here tomorrow morning?
Yes.
You're all.
Oh, we're over at Holiday Inn, but we're meeting.
Oh, okay. So I'll be there for anybody who has any last questions. But you guys know how to get a hold of. If you don't, let us know. We're certainly happy to answer any data questions that you have. And or also you can just email us, whatever. So I just want to. So we're going to do something a little interactive. And you can ask questions and stuff, and then we'll go to 11:30 when lunch is, and I'll get you guys into groups. I did want to start with this though, just a little thing I do. If you didn't know, I do this millennial presentation, and I'm not going to talk about it, but I did it. I did it as a keynote 35 times in the last 2.5 years, all over the country. The last time I did it was last week in New York, and then I retired the whole thing. I took the folder from my computer. I copied it into an old project drive, and I did it. And so I told my wife that I called it, I based it, Jerry Seinfeld in the 90s had a Broadway show, he called it, I'm Telling You for the Last Time. And then he did all his best stuff, and he retired it and never told any of those jokes again. And so I did it, and I called it last week, I'm telling you for the last time, I'm never going to do this. But I just felt like I had to tell this one story that half of you have heard, because it's such a great story, and it's about London. And I know I've been telling the story for so long. But he's in the room and he's never heard me tell it. And so, some of you have been around long enough to remember London was really little in the beginning, and I remember taking him to a Department of Health meeting, and he's like playing with cars under the table. There was one time in Teton County, there was a coalition meeting, and he was building a model car because we wanted to go see the Tetons. Anyway.
All I remember from that is a meth poster scaring the hell
and apparently those posters worked.
Travis, you can attest.
Yeah, so anyway, I'm going to just tell you the story. I'm telling you for the last time. When London was about 12 years old, he was really into physics. And now you all know where this is going, right? Half of you do. So he was really into physics, and he would always tell me about this thing called the CERN project, which is the European Nuclear Physicists Association, where they were digging, and he would come and he'd say, oh, Daddy, there's this thing about the CERN project. And they're digging this tunnel. It was in Germany. They dug this big tunnel. And there were people, the workers digging, and the physicists, and the engineers, and the builders, everybody. And he would come, oh, Daddy, see what happened with CERN today? And I was like, I would pretend to be interested. And one day he comes to me, he's so excited. And he says, Daddy, did you see what happened with CERN today? And I said, no. And he says, so they're, everybody's in there, they're working, and the physicists, and they're digging this tunnel, and they're digging, and they hit this pocket of helium. I was like, wow. And he said they had to evacuate everybody, the engineers, the builders, everybody had to get out of there. And I was like, wow, that's really interesting. He says, Daddy, how do you think they figured that out? I mean, do you think there were two guys walking along, and the one guy says, hey, does anybody smell gas? That is the last time I'm telling that joke. But I just had to because he was here, and it's a true story. He's a funny kid that way. So you'll be happy to know I don't have a PowerPoint. I know you're pretty disappointed because you really wanted to see another PowerPoint. I actually really like doing PowerPoints. I just don't like watching other people do PowerPoints. And I don't know if you caught it, but Eric didn't do a PowerPoint. Eric did a Prezi this morning because that's Eric. So what I want to do is break into groups. And so what we going to do until lunch is talk a little bit about how you use data. And I think we're in a place in prevention in Wyoming right now where, because of budget cuts and different things, using data is as important or more important than ever to try to convince people of different things, stuff like that. So my pitch to you is looking at the data we have, and there's so much sort of stuff. You've got to sort through it, and we're struggling with that with the opioid stuff. what's good, what's not good, how do you tell the story, how do you put it together and draw conclusions. And so what I'm going to talk to you is 4 general ways to use data, and in no particular order. The first one is to make good decisions, right? The second one is to help you write grants. The third one is to evaluate your efforts. And there's a fourth one too. No. And the fourth one is to engage your community and tell your story and get community buy-in and recruit people to the effort, right? And so those are the 4 major ways you can use data. And so we're going to work on that today. And so what I want you guys to do is to get into 5 groups. And so what we could do is if we would take these 2 tables is one group, and the next 2 is another group, and then, let's like you guys are one group, and then maybe half of that table and these tables are one group, and then that table, so 5 groups. Do you want to do it like kindergarten? All right, we're gonna do this. It's Lynette's idea.
No, don't throw me under the bus.
I do every time I present. I throw you under the bus. Let's do it. What's that?
Your way is good.
Okay, do it. You 5 groups starting in the back. Just pick 5 tables. Start in the front. Get about 6, 7, 8 people on a group. You're adults. You can do this. You have 1 minute to do it. Go.
Oh my God. No, take this, Travis.
I'm the champ. It's good for me to get up there. But then there's
You can join this group, but I'm going to warn you right now.
I'm good. Nope. I just let it swell up like
Are you guys all
But you're too, right? If you guys are in group 1, I need those back. Each group gets.
They're not Are they with us? Yes. They're going to add with us.
The best part of this is watching London trying to live stream it. So what you have in your hand is somewhat a work of fiction. The data in it isn't a work of fiction. It's actually from the new PNA mostly, or from what Lauren presented. But what you have in your hand is this exercise where you are from Buzzards Breath County, Wyoming. And we've used that since 2001 with the original SIG, so we just keep using it. It's a fictional place in Wyoming. And what I want you to do as a group is answer or address the 8 tasks. Now, it could be as a group that you would like to give task 1 to 2 people and task 2 to 2 people, or you could want to do it together. But what I want you to do is answer each of these tasks or do each of these tasks and then come together and agree on them. And then we'll report out stuff. But the first 2 tasks have to do with decision making. And so what you have besides, I'm just going to blow up. Sorry, London. At the back of it, you have a whole bunch of data. And this is actual data from the P&A from an actual county. I have changed all the titles to say Butter's Breath, but there's a reward. Lauren has chocolate, because I don't have any, but Lauren has chocolate. Lauren will buy a copy. If you guess which county's data this is, the first person who knows. Oh, good job. Tara wins. It's actually...
Tara cheats! Tara doesn't win! Tara cheats!
I read fast!
Tara cheats!
So,
I read fast!
actually,
left it on the sheet.
I just wanted a big... What?
We left the name on the sheet.
Where?
Horrible.
So anyway, it is the data from Natrona County, because I wanted a big county, and Eric gave it to me. But don't go share this as Natrona County's data. But it is real information from the P&A. And then the other thing that you have at the end is that picture from the profiles, the very first one that Lauren shared, about hospital admissions and discharges. Okay? And so what I want you to do as a coalition is talk together, and if you want to separate the work and create subcommittees, that's fine, and ask these questions. The first 2 tasks have to do with decision making, right? What problem and what population are you going to target with your prevention efforts? Now, given that I can't give you all the data in the universe, if you have other things you might know about your community, if you want to have a discussion about that, feel free. It is kind of a work of fiction. No one's going to hold you to this plan, right? But the first question is, what problem and what population will you target? The second question is, what are 2 evidence-based strategies you're going to do to target that problem? Right? Preferably at least one of them is environmental. It could be the 2 are environmental. Right? And the goal of this is just to practice looking at data and making decisions. The second thing is about grant writing. The 2 questions, or the 2 tasks under grant writing, I literally copied verbatim from the Drug-Free Communities application. Right? And so as we move forward with sustainability in Wyoming, Drug-Free Communities is a big thing. And I was just telling Sally, this is we're walking back from coffee, is that and despite the president's new budget with a lot of cuts to social services, the emails I've gotten from ONDCP and CADCA is that there haven't been cuts to drug-free communities, and in some places I think there are going to be increases in the number of drug-free communities that are out there. Drug-free communities are a big sustainability thing. That's not money that goes to the state, it's money that comes straight to the community. So these 2 tasks are literally from the Drug-Free Communities application. Look at data and say, describe the substance abuse problems in your community, and the second one is write an outcome-based objective for your DFC application. The third task is about community engagement. What 2 sectors do you believe, based on the data and the information you're looking at and the problem you're going to target, what 2 sectors do you need to get and engage and bring to the table? Is it schools? Is it energy industry? Is it somebody else? Right? And once you've identified those 2 sectors, the next task is write an elevator speech. If you only had 15 seconds with one of those people, what would you say about the data to convince them that they need to do this and that they need to come to the next coalition meeting? And this is like the real thing. When we were working in Niobrara County, where's Carrie? And we were working in Niobrara County with Carrie and Sally, and this is an issue for them, is that they're not, one of the things we're training and doing TA on is how do you tell your story to get the community engaged so that they recognize this is a problem and something needs to be done about it, right? And so you've got to write that elevator speech. The next thing is evaluation. And based upon the data from the P&A that I've given you, how would you interpret it? Your efforts so far. How would you tell somebody, does this stuff seem to be working or not working? And then finally, name 2 specific indicators from the P&A that you will use to track the outcomes for the problem that you identified here. Questions? it seems to me when I was putting this together that it would be good to break into subcommittees to do it. That you can do it as a big group too. And when we're done at about 11 o'clock, I'm going to have each group report one or two of their answers. We won't do everybody do all the answers. Any questions?
So we have till 11
Yeah.
o'clock.
Huh?
So we have till 11 o'clock.
Yeah, prevention happens really fast.
It's a sprint.
Go. And let me know if you have thoughts or questions, or Lauren can answer things too.
Do we not have the first round? Yeah, question. Yeah, well, two is going to be based on decision one.
Does everybody know where everything else is?
Who are you again?
Which meeting?
Do you know everybody's out?
Prevention in Suffolk County.
Oh, right.
Yeah. Just turn it on to the
That would be alcohol. You pick one of those for E6. It would be 35%. Spring specifically, I tried to do this to include the language yeah, so you can take it down and use that. No, that's fine. No. Well, you have, but that's what they call them. But if a minor's in possession, then it's but we can just call it.
And George's looking
As a alternative.
which is good.
Yeah, exactly. No, that's good, and I think that's why Prince was that. Well, the youth, they're receiving it. I think that's why he got. They're usually so they're taking it from other, so one, so at those, by the alcohol, we're looking at.
I still like
Yeah. So they'll do it in Illinois by
and I think by the end of this.
Are you on our thing? Okay, sorry, I'm on the other one, join us.
Parents' favorite bus to be there.
I think it is.
Okay, yeah. You can see it. Well, we have to take those, they're getting it from their parents. And then there's going back to the
It wasn't up there either.
Yeah, isn't it awesome?
Really quickly, just someone had a question. So you know that very last chart, that opiate chart, that's the one that Lauren showed, and it's per 100,000. It doesn't. I didn't include that little graphic, but that's the number per 100,000, so it's a rate.
So for alcohol, the risk factors, the highest for parents favorable attitude. So that means that kids think their parents are terrorists and the perceived harm. So it drops that. I think she's writing a book and oh, why we do you want to mention this parents favorable?
I mean, we still have really.
What about, so another thing is Carol Mead is talking about so that so it could be so that could be good for alcohol.
You start yeah, well, that's the thing. One thing's not easy to catch.
So that's so alcohol and also
So we're trying to seniors and the young adults, like the parents come by, because that's what
Name two specific availabilities.
And then,
We could say
Which would still
no, I had so.
They said that he saw the meth poster at Scared. Travis has the same scared tactic that worked on him.
What's that?
The meth poster. It's the same tactic worked on our little Travis.
The thing about it is it works on me. There were two things that were one, academic research showed that in terms of the other thing that is really sort of negative is unfortunately like in this like that's pretty far down the line, right? Your fingers falling off and stuff. And so and some of the Romans like Sansa and treatment providers and stuff, you know, addiction is dangerous and stuff, and these people need help, they're not, and so it really stigmatized the whole notion of having drug addiction. And also sort of made it so that we all thought everybody was doing it. You know? Like, I get this data from Weston County.
My girlfriend is still convinced that there's like, that is still like convinced that it's like a huge problem everywhere. And like you come from the former meth capital of the world and you never even know.
So, but when, like, we had this data from Weston County, and we asked a social norming question. So we asked, you know, in the past 3 days, on how many occasions have you used alcohol? But after we asked the questions, we also asked, in the past 3 days, how many occasions have your peers used alcohol? So we get a sense of the misperception. You know, 30% accused, but 80% think everybody else is. Right? And that's bigger than misperception. So Western County, it was back in like 2022. We asked a question, and we asked, when we asked how many occasions have right? And so the answer to that that they believe that the high school students in Weston County, they believe 66% of them believe most of their peers. 66%.
That's huge.
Could you imagine a school where, and it's so that was their belief. And it's based on their time, it's based on what you tell people. But we also asked them, how many how many of the kids in Weston County have ever tried methamphetamine? Not one. But the reason is the billboards up saying it's but I'm not saying it didn't work. There was never a test class. Well, that's what they're trying to do with the marijuana stuff right now. So we're working on that with the last question, and that's because they're finding with the education, that notion of the perceived risk response, and what we've got over and over is marijuana safe. I mean, there's like the guy yesterday was talking about, like this notion that you drive better when you're on marijuana, or you know that it's a healthy medicine.
So I do that, and then like
right, like that perceived risk is really big.
Have you seen the whole gateway drug? I don't know if you've seen them talk about chicken finger thing. They're mocking the gateway drug.
Yeah, okay, so there's gateway drugs is there's a question that like people who are on methamphetamine, they're not like, oh, I don't want to have a beer, I can get that. But just because you drink doesn't mean it's unlimited. So there are pathways So I think that general intervention, whenever we think about gateway, as saying as much as we think about that, there's clearly a pathway between having using Oxycontin because you have wisdom without being addicted to opiates, not being able to get something so expensive and really addicted and you go find heroin. And then you get kind of that, and then that gateway, that happens there, the notion of gateway. Because there's no evidence that because you just one, you're going to definitely get another.
Well, I was just going to say, but like, I don't remember like, just remember wandering around in like some office building and seeing like a terrifying skeleton on a poster and like, why?
So it's funny, you know, when they brought them on,
So we gotta convince
Wyoming,
to convince our parents.
free to call it
So I think what I've done traditionally
they don't have evidence that works, and people come here because it's a beautiful state. They don't want to be driving in Yellowstone and see like people's faces falling off and stuff, you know, on the bed. They were like, no, I'm surprised. They were like, I pay for it. They were, they were on topic. And we did environmental, and that's the hard part. We did environmental.
You know, I will say statistics, as a general rule,
That's what was ever super. It's individual levels or
But you've got a population though, being 10% are kind of the environmental populations that are never.
Yeah, they.
There's 10% that you just really, they just kind of everything beyond the environment. I know. Everything, because there's 10% that will never touch.
Well,
But that's 10% are the ones that are on the most retreat.
Yeah, no, and they deserve prevention services as well.
But yeah,
Treatment work and all the rest. That's why it's prevention services recovery, not
that is a good idea because the parents see the
think that their parents don't think it's a big deal.
So the goal is to talk to
but ours are not.
Oh, I suppose.
It's not good. You're lower than the risk from parents. So that would be, I would say, sorry. So we want to lower the data. We want to lower this, yeah, we want to increase the see over 50% data.
Hey, Christopher, there.
Yeah, it's kind of like moving up first.
parents like that's the problem. Because, well, not related skills is ordinary, like good.
I figured that was the last one. Yes. Yeah. I was so happy, but you never know. Yeah, go for it.
They will not be assessed.
Well, it just for like a second. Yeah, and then we can bullet point show live reproduction.
Oh, wow.
Underage. Drinking.
Yeah, I love Fort Collins.
8% parent.
Big Fort Collins.
Received their
Yeah, that's what I hear. Because Fort Collins people hate my friends visit.
Writing a
That's because they have their students before they get to the
Like maybe substance use.
Yeah.
That's not even using
It's
cool.
a really cool idea. And the population is really struggling.
Then if you phrase it that way, parents
When I moved here,
and then it's like, well, I don't feel good.
I get a 2-bedroom, 1-bath apartment, this much. Compared to like the 24
You can also say, so how
This has to, this line has to. Let's
are
say you drop the That's it, that's just. So let's say we drop parents. 20%. No, I thought that was just interesting.
Yeah, that's sad.
You're getting
You're getting 100% towards that statistic right there. Well, actually, when I was a senior, I had a buddy who had a big tuition scholarship.
Nice.
He never got college.
Yeah, so I can put our kids in giant our kids report, the actual users
And is that Bob Fish?
I don't know why.
So now
That's so bad.
that's why I was like, this is that's why I had to look up. I know, that's the whole thing. That's like where we're, but that's, if you're expanding, where is that?
That's basically what is out there.
Get that email. So we share some of the info, say this is reaching out. But you would working on
According to the Biennial,
so are you willing to be part of this? They think that they are willing to think that they're thinking that 80.
Well, the stats are probably worse for alcohol.
7%. Well, and the are focused on this 7%. That's hard to protect the truth. So they're thinking
That's one of those, if you answer no, you're right.
Yeah, exactly.
Our kids are bad. That's right.
Are you all for that?
Yes.
That's an interesting one. You can make it, well, it's not that conversations to bounce on I think our increase the perceived risk. Okay, so we don't even.
So you guys have about 15 more minutes. That's all the road problem. About 15 minutes.
It's kind of like Cake Boss, Cupcake Wars. 15 minutes.
That's like, that's not the one, there's something more.
It's called opioid.
Interesting, so that would be good. I don't know. Oh, wait, so that was.
We have trending upward on another.
That's,
Because people don't see that it's right.
well, that's one thing my father would do. Right. And it really upset me this first year, because I didn't bring
Oh, yeah.
But then when they left off the kids, none of them wanted to. Yeah.
Those that are perceived risky, we have to give numbers. Never do that.
Yeah,
The measure.
that's what I was thinking. It's like,
Well, I sure will objective. By the end of this grant, they're going to decrease this problem by this much.
We can give it stats, like we want to go from 50% down to 46%.
And typically those numbers are just like last year. That's what people
There might have been some impact that first year.
There are different ways to think
But
about
then,
it.
like, following year, the kids knew what it was, so it was more of a game and just a fun
It
thing.
definitely is.
Well, I'm gonna go see if I die.
And
Alcohol is
alcohol-based injection has like 80%.
Oh, am I gonna get pregnant?
And usually like 5 to 5 over time. Just so you know, that's smart effective. Specific measurable. Realistic. Attainable and realistic seems the same to me. And timely. Right. So by when, we're gonna do this, by this time, by this month.
Or we want to increase. Because to increase parental.
Doctor's stations.
Yeah. And how's that? So 6%. You think they like science, yeah, whatever. I say 10%. I just say actually, we want to make it 0. I thought maybe you were trying to trick us.
Because aren't you supposed to do like a evaluation later? There's supposed to be like a post evaluation of how this impacted these 6%.
So my coalition passed
Well, then when they do the seniors,
that's our big
is
thing.
when they had the house party, and the
I'm
seventh
3% of the resolution to board of
the
trustees.
seventh graders were showing the seniors. Yes.
Once an hour, trying to figure out.
Well,
that's
to do it.
I've never heard of that.
All the money and resources. I sent you my DDA regulations. Unfortunately, there's some other regulations. Kelly's gonna send me the, I asked him to share that.
So we're working on that. Selling.
Well, I'm telling him that something that's being
Like a solution, not a problem. Because obviously, parents aren't very
Drink your coffee and then take a nap. And you wake up and you're really refreshed.
I don't know.
I guess it's
That's like this.
I mean, there is business limiting
So that
I did for a while.
people still eat, but there's not at all. Some people
And what do you work with? Oh, you're in the governor's state town. My grandpa's name is Oh, that's, yeah.
He's like,
We all are. I know people there.
do y'all want to come together and see if it all fits? Sure.
Because it's like you can get when the sun's up, it's straight down. I've been working midnight for 30 years.
That'll take like 30 minutes to get your own practice.
It's so fun.
See, some people are crazy, they can play movies.
I know, I can't agree, that's
So do you,
15th or 7th of June.
so Stanley, you work like the dispatch or? Yeah.
Until the cops will go.
Okay. You only have a few more minutes? You only have a few more minutes?
excellent person.
I don't think.
Trying to send it downward.
Which is totally fine.
You said you don't want to see the suicide emergency.
So,
Well,
of course, where there's some.
we deal with
We talk about, of course, the
suicide and stuff
all
that
these
comes
stuff,
together.
like maybe having a
Unfortunately, last
because they show the heavy smoking.
See if there's a higher risk. We're still having them, but they're not on campus. That's fine with that. I mean, it's not good, but yeah, it means that we don't personally have to deal with it. But we also work with counseling and testing.
You guys almost done?
We're
Are you done?
Hey, Rodney, I have
Yeah.
the answer to our hotline.
You have what?
It's kind of what deal with people decided they will call them cops. So when that particular night rings, you have a different hat. And just the answers are recorded. People within our department will understand that. Try to complicate
Alright, we're gonna have to come back together because everybody's getting done.
A few years ago, they decided we should do more counseling questions. Like, whoa, no, we're like any other assholes. You get your name, your phone number, you have to get off the phone. That caused on our end and also on counseling centers. People don't understand what other people do.
You only have a couple minutes if you're not done.
Yeah, I've done a lot of training and stuff on dealing with
Okay, time to turn off, like, right, as you circle.
Yeah.
I'm the building.
Sure, yeah. Not every day's the same. Yeah. Work on that.
Well, that's well, that's what happened tonight. I don't want to get sick. I worked one day and
Really?
Dawn's in.
Okay. That's enough group work. Let's just come back together for a second and just do it. Which group would like to go first and talk about decision making? Somebody volunteer. Sally, sit down. 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 Which group wants to talk about decision making? Somebody volunteer. There's group number 2. What's your group name? Did I tell you how to come up with a group name?
Did you tell us what
No, I didn't. You're group number 2 though, right?
Yeah.
Yeah, so in terms of decision making, what did you put for number 1 and 2?
30-day alcohol use, 12th grade use is high. Should I read the question first?
No, everybody knows the question. So the question is, what problem and what population will you target?
So we're actually going to target 12th or 10th grade because the 30-day alcohol use for 12th grade use is high. And so we would like to see that change.
So you're going to target 30-day alcohol use among
I want to push this out link. Is it on YouTube?
high school kids for get them early.
Do you know what that link is?
So when the 12th grade comes out of,
Okay.
I should have really grabbed
Awesome.
Tracy's email.
And what are 2 evidence-based strategies you're going to use?
An educational campaign targeted at 21 who provide to minors. And then a policy change to include a community event checklist to include post-secondary in existence in the community.
So let's talk for a second. Your education. You're going to do an educational campaign around to
Brain
young adults.
development and laws. Brain development.
Yes, brain development.
But the educational campaign is for 21-year-olds and older who are lying.
Yes, and providing it.
And parents, so that they know that they're going to get into trouble and that they're doing something wrong.
Yes.
Okay, so a media campaign.
Yes.
Okay. And then the second one is?
A policy change to include is not. Yeah.
Working with city councils and county commissioners to create a policy change that includes a community event checklist because we're under the assumption that these 12th graders are reporting that they're getting this alcohol at community events.
So getting into community events and also from people who are older,
Yes.
shut down that availability.
Yes.
And also the media around that for the people who are providing.
Yes, sir.
Okay, good. Anybody, in terms of decision making, choose something besides underage drinking as the target? Yeah, group. What do you guys choose?
Well, I mean, the question was what problem, so everything that could potentially be a problem.
All the problems.
Right, alcohol, marijuana, and prescription drugs potentially, because those numbers could be.
And which population?
In 12th grade, I think was.
So the teenage population.
Right.
Okay. And what different strategies would you choose then?
So we picked an environmental strategy that included social norm campaign.
Okay.
That targeted the parents to understand that they're getting access for them when it comes to alcohol.
And what got you to a social norming campaign in terms of data?
In terms of the data, there's huge gaps between actual usage and the perceived risk.
So the perception stuff.
Yeah, between both alcohol and marijuana.
So there's a tremendous amount of misperception.
Yes. Can we point out that you have your graph back? Oh, it's not. You just did too. Everybody's like,
So A, it wouldn't be me, it'd be Eric. Yeah.
Right, and so then the other one we picked was that we recognize that our county, among 6th and 8th graders and even 10th graders, all fell below the average for social skills. So we
That
decided to
zero
implement
is
a
the key.
social skills program.
Okay.
Within 6th graders, the first semester, because that's where the.
And so this is actually another program in mind. National school-based program. Also, okay, which also doesn't work.
Or transition.
Or life skills.
Exactly.
Anybody pick something different as a strategy that you might use? Any other interesting evidence-based strategy that you might use to address the problem? Going on? Who wants? Yeah, go ahead. Megan.
Evidence-based strategy,
Yeah.
you chose parent imposed.
Okay, so you have, there's a social ordinance in Wyoming, potentially in the community even stronger language, but you're going to do the media campaign that goes with it, so people are aware of that and know. And working with law enforcement to actually enforce those. Right. Visible, I was in this argument with Sean Hartman from Oregon, who does tobacco stuff. And sort of the theory behind that, though, is once you've made the ordinance and the laws, you don't really need to enforce it very much. I mean, if you look at Laramie, we passed a smoking ordinance, and it's not like the police are going and checking it all the time, we have smoking ordinance. But when you're doing alcohol prevention, it's different than that. We know that visible enforcement is a thing. And so Dave Chevelle, who most of you know, it's so annoying because when I was in New York, I'm like, so we're doing Dave Chevelle, and then every time I say that, 3 people in the room go, oh, I love Dave Chevelle. Oh, don't encourage him. But he does this thing, and it's a great way to understand visible enforcement. How many of you drove to Laramie to come to this conference? Keep your hand up if you know the speed limit between where you came from, right? Now keep your hand up if you may have gone over that speed limit. Not true, seriously.
I mean, see people, I gotta be careful.
Okay. Yeah. Now keep your hand up if you went over the speed limit and there was a law enforcement officer behind you. Right? It's a visible enforcement of laws, and that's part of it, right? Visually enforcement. All right. What group would like to volunteer about the grant writing? Grant writing. Who wants? This group 2 already went. Who wants to talk about the answers? You guys. Okay, Erica. So these are actual DFC questions. So number 1, Erica, in a couple of sentences, describe the problem you're seeing. Speak loudly because your back is smoking.
Reason for that. Describe your substance abuse problems within your community. Talking about 30-day alcohol use for adolescents has increased over time, but is higher still than the state. That's all she wrote down.
So alcohol use has decreased over time, but it's still higher than the state average. Good. And what would be an objective that you would put in the DFC application?
As far as a measurable objective for a long term, I'd be looking at the PNA 30-day use, but we said that we want to be looking at law enforcement data, possibility of school data, so that we can use those as short.
Besides, what was the actual objective?
To reduce 30-day use by 5% in 5 years.
To reduce 30-day use by 5% in 5 years. And so, this is a story from Florida. Skip Forsythe, who used to be kind of an Erica's job in Florida, once told me he was working with Miami-Dade County. Miami-Dade County has more students in their school system than Wyoming has people. Right? It's really big. And he was working with Miami-Dade County, and they had an objective just like that. Reduce use by 5% in 5 years, right? And he went to them and he looked at their strategies. And he said, based on the strategies you have, and based on the size of that, 5% of that number of kids is a larger number than the number of kids that go through your program. So don't tell me that if you're not going to do environmental strategies that you can get a 5% reduction, because you won't, because you're not even touching 5% of the kids, right? So that's an argument for, so when you get to those numbers, like 5%, think about what that means. What are 5%? And even if you're successful with every kid, right? So that's an argument for doing something like social posting and enforcement is you're going to get that sort of large numbers of decreases and push it down further. You're going to have things that hit the whole population. Anybody else want to talk about an objective they wrote? You guys had one, right, Renee?
Yeah, but we lost it. Travis took it.
It's here.
Oh, okay.
To increase the perceived risk of parents of underage alcohol use, to lower parents' favorable attitude toward drug use by 10%.
So you can also increase something like perceived risk. You can increase a protective factor, things like that. Those also from the PNA can be used as objectives. And a lot of we haven't done a CADCA Academy in Wyoming, and I know you guys kind of understand the general sense of it, but the CADCA Academy is 3 weeks of training, and you graduate from it, and it's very intensive over a year. And one of the things CADCA talks a lot about is understanding your local conditions. So I know we've talked in Wyoming a lot about causal areas like retail availability, right? What CADCA says is you may understand a problem like retail availability, but what's that look like? So we could have 2 communities. You could have Natrona County and Albany County both have retail availability problems, but in those communities it looks different. And what Katka says is you have to be able to take a picture of it, right? So when Albany County says we have a retail availability problem, you know, what Katka would say is, can you take a picture of the place that's selling to kids? Because once you understand the place, then you can go to them and say, we need you to do this differently, right?
Yeah.
And so that's part of that. Any other sort of objectives or sort of different grant writing sentences that you might do? I know you all write sentences, but I do think that maybe one of the things we need to do in the future in Wyoming is say, how can we leverage DFC funding? We don't, as a state, do much compared relative to other states that have dozens and dozens of DFC communities. I think right now we have 2. Something now?
There's 2, and we just had 3 apply.
We had 3 apply. So, but we certainly could have 20 applications. There's no reason we couldn't. So that's why I included DFC. Anybody else want to put in one? Let's go to the community engagement. Who wants to take that on?
Oh, we do.
You do?
Yeah.
Wait, you haven't gone yet?
No, we just support it.
Okay.
Okay.
So community engagement. Cassie.
Yeah, we picked
Number
parents
1.
and
What 2 sectors?
Parents and young adults, youth, young adults,
Youth and young adults.
and parents, which can
Wait,
fit.
youth, young adult. Well, there's 2 different things.
Yeah, okay.
3, that's 3, but you can do 3.
We'll do youth and parents.
Youth and parents.
Yeah.
Those are people that aren't on it.
Yeah.
How many of you have in your coalitions have actually active youth and parents or parent groups? Yeah. I mean, I know a lot of members of the coalition are parents.
Yeah,
but that's different than
solely
being
parents.
a member of a parent organization or something. And also using youth. How many of you have youth? And keep your hand up if you use them not just as tokens. Right? Like you actually use youth well on your coalition. Because a lot of times.
Define use them well.
Well, I don't know. So Matt, you raised your hand quickly. Well, how do you use youth not as tokens but actually well?
Well, they've been involved with both our coalitions, getting more information, like, so what do you see at the school? So that adds to the conversation and decision making. And then it's just our suicide prevention coalition. We had a person who was doing a senior project, and she helped us with the gun locks. So.
Yeah, anybody else? Drew.
Well, I know they're not here, but I can speak for them. As Park County, they're one of the Drug Free Community grantees, and I know that they brought 2 of their youth to the CADCA Academy. They have a whole youth track, and they had both of their youth involved who are still involved. So they take them to trainings, and they do all that sort of stuff.
And we have youth that present to city council,
That's
or
great.
school
Youth
board.
presenting to city council.
Yeah, we can't tell them no.
I think that a lot of us used to have really active youth groups. And then when we kind of weren't allowed to have active youth groups for a few years, now it's about back to rebuilding those groups.
Were you not, I don't know if you weren't allowed. I don't know. Okay, I'm not gonna go there. We did, I have a, if you're interested, if you are rebuilding youth groups, and you're interested, when Trina and Anastasia worked with me and Bicycle Living Rooms, we did a little study of the 9 components of a successful youth group. If anybody's interested in that study, and if you want to share it, let me know. Christy seems to have it too. We'll share that with you. You know what's really funny? You get these moments of as a researcher, very few of them, where you sort of feel like you're doing the right thing. We took that to the National Prevention Network conference in California several years ago. And an example of youth that are really active in a coalition, there was a youth group in California, if you remember this group, that went to the beach and collected cigarette butts and put them in this, do you remember this group? Put them in cigarette in bags, and they went to the city council and dropped them on the floor and said, boom, we need you to make our beaches smoke-free. Right? That's like a really powerful youth group. So Trina and I presented on these 9 things we thought, and all of a sudden these kids walked in the back of the room, and they were that youth group, and watched us, and we felt so much pressure. Like we're researchers, and all of a sudden these high school kids walk in, they're like, boom, we're gonna like, and afterwards they came up to us and they said, you nailed it. That's exactly what makes us successful. We felt so good about the validation. Yeah. And so if you want questions about that. Who else has somebody else in terms of sector membership? Somebody different than youth and parents that they put. that would be important to get that you don't have?
Did we have drug dealers on our?
Yeah.
No, electeds, we had electeds. Elected officials.
Elected officials. Difficult sometimes. Who's got an elected official on the coalition that feels like it's really useful? How so, Patty? Patty. Sally.
How is it you?
Patty? Patty Satin.
Patty just came out.
Patty
Sally,
Satin.
Patty just turned into Patty.
That's
Sally.
right.
She's molting.
People have influence. And they become informed about the work, and then when you need to make decisions.
And you've had that person on your coalition. Who else? Other people. Carrie.
I have two mayors that sit on my coalition, and one of them is actually really participating in money. And I would echo what Sally said, they're the decision makers, so the more informed they are, the easier our job becomes to get the ball rolling.
They can put pressure where sometimes.
Well, with our county commissioners, sometimes they bring them to the table.
Yeah.
Because here's what's going on, what do we do?
Awesome. What's another group to get?
Junior colleges, if you have a junior college.
So the community colleges and junior colleges, getting a member of those. Does anybody have those people? Faith-based. I was doing a presentation on environmental work and how coalitions work together in Mississippi. I don't know if you've been to Mississippi. There's a church on there are more churches than there are Starbucks. Like, it's amazing. And we were doing, I had them in groups doing this thing. And I'm hearing this discussion, who's going to be in this work group? And this guy says, I'm just like, it's like this, right? I'm just walking around observing. And one of the guys in the group, he says, well, do you think we should get faith-based communities? And this woman was sitting there, and like the most beautiful Southern accent, she goes, it ain't going to work without God. Mississippi. So anyway, faith-based. Do you have that? You're working on a level, but you're trying to have that. And what does a faith-based community bring? I'm putting you on the spot. A religiosity protected factor. But what does it bring to a coalition?
Well, it brings a huge cross section of people because you know.
Why do you say cross section?
You're smart.
Oh, that's a good pun, yeah.
Yeah, but I mean,
Not
there's
so much
a
for the
good cross
synagogue,
section.
but
Yeah.
You
A
cultivate
good
some
cross section
stars.
of people at churches, you know, in churches, and so you have an opportunity to reach some people if you have their pastor or youth pastor or something like that on your coalition that maybe you wouldn't have as your champion otherwise.
all right, who wants to read elevator speech? Oh, Cassie's so excited.
About that. That's all.
Elevator speech, Cassie.
I'm ready. Hey, Rodney, glad to see ya. Thanks for taking the time to talk with me real quick. You know, over 50% of our 2016 seniors in Buzzard's Breath think that their parents have a favorable attitude towards substance use. Our kids report accessing alcohol and e-cigs at home or through someone over 21. Can our coalition count on you to help address the issues in Buzzard's Breath County?
Nice. Anybody else got an elevator speech on read?
Yeah, we might have
They'll go.
We in Buzzard's Breath are concerned about the effect of alcohol on the breath of our youthful buzzards. Here's the great news. Here's the great news. 30-day use of alcohol has declined in Buzzard's Breath by 9% from 2012 to 2016, from 48% use to 39%. And we need your continued support to maintain this positive inertia in decreasing underage drinking. The perceived risk of alcohol consumption remains low among young buzzards, and parental buzzards' favorable attitudes of substance use continue. Data shows that house parties where parents or other known adults provide alcohol to our young to get buzzed are a major concern still. Join us in our Parents Who Host campaign to tell parents that it is illegal to host underage drinking parties. Thank you for your time. Dr.
That's a long,
It is
long elevator.
That's
floors. You know, Robbie,
I had all these notes that Darby said I had to include.
That's good.
I think the only
Renee?
person who can do that.
Sorry.
Yeah, I think one of the things that I would like to try and focus on next year is working on more of the positive things that we've done, seeing some of the data that was given this morning.
Yeah.
I'd really like to be able to present that to my coalition, my community, my elected officials on what we're seeing on the good side of things.
So you gotta kind of
There is a balance.
focus on that and.
There's a balance between talking about the good
Uh-huh.
and talking about the problems,
Mhm.
right? And you guys always strike that balance. It's a hard thing to do. You have to.
But that's a great point, because we often lose track of this,
Right.
that good messaging balances hope and concern. Because we can message concern all we want,
Right.
but without the hope,
Mhm.
what's the future?
We can still show the
That Bill touched on
the need.
in his
Mhm.
is
But to add.
that our numbers have dropped, and we hope to continue to see that drop, and the way we're gonna see that drop is by everybody working together.
The
And so I think
continued
you're
inertia.
utilizing the positive messaging, but not demeaning what the problem is either.
Good. And at risk of letting Bill talk longer, could you say 2 sentences about your idea of shadow leadership? Is that what you call it?
Leading from the shadows?
Leading from the shadows.
Well, it's just a goal, and that in community prevention, the less my community hears my voice and sees my face, and the more it's our coalition leaders and our law enforcement leaders and our mayors who know prevention, or our county commissioners in Carbon who know our prevention. That's the recipe for sustainability, I think. That was more than just.
And this is gonna help, I think, in the next year. Unfortunately, we've had a significant budget cut, but this is gonna help us utilize our coalitions more. Like my law enforcement has jumped right in and are making all the copies for things and supporting in different avenues. So they're taking on a higher approach in our community, and as well as our churches have jumped in to help. So it's kind of nice that now they're going to be leading my coalition a lot more than my PMO logo. So.
Nice. And I just want to ask, it's interesting. How many of you were at the very end of this fifth SIG at the Knowles training in Fremont County? Do you remember this? So this was a great training. It was partly because we had this we had this GPS thing. We had this GPS thing, and they made us. There was like a time thing. How many places could you get? I was on a group that we were made up of some people that were very fast walkers and some people that were not so fast walkers. We realized after the first 30 seconds that we were being penalized by the group being more than like 10 feet apart, that we were not going to do well. So our group changed the rules, and it was just. We decided that the rules were who could see the most cool things, not who could get through the stupid Knowles thing. So anyway, it was super fun. But there was a moment in the end when we were processing that, and I don't know if you guys were there, remember this moment, but Tracy Young said, "Wow, until right now, I didn't think it was our job to change the state of Wyoming. I just thought about Laramie." And now I realize we have to work together to change. It was a really powerful moment, if you guys remember it. And I think we're to one of those moments again. I didn't realize that it's not the PMO's job to make all this happen. It's our coalitions that have to do this. And that's why this kind of presentation, this elevator speech, is now more important than it's ever been.
It's good to pull back and make them more engaged.
Yeah.
They're involved,
Okay.
but now more.
So, who wants to take on the last evaluation questions?
All Wysack. All Wysack.
No, that's
Evaluation.
not the answer.
All Wysack.
No. There was a great moment at the end of the SIG when we asked people to, on their part of the report, to put what's your sustainability plan, and there was this woman from Fremont County. I believe it was before your time. What was her name? It wasn't Kelly.
Teresa.
It was before Teresa.
It would have been Lisa.
No, it wasn't her. It was the other woman. Anyway.
God, how long have
It
you worked for
was-
Wysack? How long have you worked for Wysack? Where's your cane?
I'll tell you a funny Teresa story though. And we had, what's your sustainability plan? I swear to God, one sentence. And it was, I trust in the process. Bad answer. Huh? No, it wasn't Laura, it was the other woman. Yours was Laura. Anyway, who wants to write evaluation? The first question is, Carol. Maybe it was Carol. Yeah, I trust in the process.
She was there for like a whole 3 weeks.
No, maybe it wasn't Carol. Based on the data, what would you say, based on your data, what would you tell people about the evaluation of this community or any community?
Prevention works.
Prevention works. What else?
We have more to do.
We have more to do. What else?
With the data, did you say, rephrase
Yeah,
that?
based on the data, what would you say?
There's a strong misconception in perceived use. That's what I saw in the data.
Oh, there's a strong misperception of what is going on. Things
Yeah,
are much
right,
better than they
right.
used to be.
Right, in the data.
Yeah. And it's hard, right? You guys are not expected to be big-headed researchers at a university and use control groups and stuff. But if you look at your trends, what would you say?
We're making a difference.
We're making a difference. What the data is showing us is that we're moving in the direction we'd expect to based on prevention.
But maintenance and continued prevention is critical.
And so, and the last question is, what are two indicators you would use based on the stuff you were choosing? What are some indicators you would use to track success? 30 days without alcohol. What else?
We also added binge drinking to that as well.
You would add binge drinking on, yeah.
And then we did essays as well. We just said 30-day use, but also possibly adding a question on like the frequency of use, like we do with the heavy cigarette use. So maybe adding a question to maybe think about it.
What do you mean by frequency of use?
So I guess how long they were vaping. I don't. We were trying to figure out the question.
Yeah, there is actually, what's interesting is there is an argument to use. It's not so much have you used in the last 3 days, but how many occasions have you been? And the question, and you can go to the interactive graphing, the question actually is, on how many occasions in the past 30 days have you used? It tends to be reported as used or not used. But you can look and say, how many of these people are using multiple times in the last 30 days? Can we change those occasions from 20 times to 1 time in the last 3 days? Those things we use. So my point with all of this is twofold. The first is to give you a sense of there's some 4 major areas that you can use your data. We have lots of data. And the first is to make decisions. The second is to write grants. The third is to present and recruit people. And the fourth is for evaluation. My second thing that I wanted you guys to learn from all of this is people like Eric can give you the data, but you guys locally have to bring meaning to it, right? And we don't want you to misinterpret it, but you do have to say, what does this mean? And it's not just the P&A. It's not just the overdose things. And if you look at, I'll say this all the time to point Ernie out, is Ernie's report on arrest and why people are getting arrested. It's a WASCOP report. It comes out every year, right? It's absolutely important data for you guys to have, to know why people are getting arrested. And it's a consequence thing. If you look at that, it's there for you. But you have to bring meaning to it locally. You have to say, okay, what does this mean to us? We're seeing decreases. It's a good thing. And how do we use it to tell people to join the cause, things like that. So those are my two points in doing it. Do you have any questions, thoughts about the use of, with the last couple minutes we have left, questions about us for data? I will tell you my one Teresa story, just because I love it, because we're in the same hotel in a second. Any thoughts, questions, anybody hungry?
Hungry.
So we're resuming again, where's Tracy? I don't see her here. We're resuming again at 1 in this room. There's a panel on opiate data and things like that. So all those things that you were picking on Laura about, this is the group to pick on. Laura. Lauren. I said, I just named it. It's just like ending too fast. Lauren.
Yeah, you did.
There's a lot of us, right? Lauren.
Lauren. She's the most important L name. Right?
I'll tell you what.
Just don't tell her.
At YSAC.
The most important
Yeah.
That's true. That's true.
Renee, I see her yesterday, and she calls me Lauren. And I was like, I'm not anywhere even close to looking like Lauren.
else.
No, I meant Laren. I'm like, please.
I would blame it on pain medicine, but I haven't taken any pain medicine.
I would much rather be mistaken for Lauren than Laren.
First I said Rodney, and then I said, oh wait, do you mean Lauren?
She doesn't even. My last story is, I just to throw Teresa some shade. Teresa, what's her last name again? She worked with you? Armani. We were presenting, do you remember this? We were in another part of this hotel 3 years ago, and I was doing a presentation, and I drew up a picture of my twins, and they're so cute. And everybody, you guys are, a lot of you are, and everybody, I'm like, those are my 1-year-old twins, and everybody goes, oh. And then Teresa from the back of the room, she goes, wow, your wife must be really pretty. That's really golden on my.
That's awesome. I remember.
Just Teresa was great. Thank you guys. Have a great lunch. You have to be back here at 1. There will be live reading. That's all.
Dang right. Sorry, people were taking your.